The final drug class that will be discussed in this chapter is the TNF-alpha inhibitors. There are 3 of them that you need to know about: etanercept, infliximab, and adalimumab. So how do they work? They all block the function of TNF-alpha, but they do so differently. Etanercept is a decoy receptor that binds to soluble TNF-alpha, as you can see right here. You can remember this by remembering that etanercept is a decoy receptor for TNF. What about infliximab and adalimumab? As you can tell from the AB ending, they're actually antibodies. Their antigen is the TNF molecule. Etanercept and adalimumab have the same indications, including rheumatoid arthritis, psoriasis, and ankylosing spondylitis. Infliximab only differs in that it is not approved for the use of psoriasis. Which of these drugs, etanercept, infliximab, and adalimumab, may be used for Crohn's disease management? Only infliximab. As you may remember from earlier chapters, the toxicity of the TNF-alpha inhibitors is that they may predispose to infections because they are modulating an important part of the immune system. So, before starting therapy, what must you absolutely do? You have to test for latent TB. This will definitely show up on your step 1. Do not miss it. Let's do some practice questions now. A 27-year-old man comes to the physician's office with a 6-month history of low back pain and stiffness that wakes him up during the night and is worst in the morning. The patient was diagnosed with bilateral sacroiliitis 4 months ago because of his tenderness to percussion of the sacroiliac joints and pain on springing the pelvis up. He has severe limitation of motion in his lumbar spine. Lab tests are most likely to be positive for which of the following? A. Human leukocyte antigen B27, B. Rheumatoid factor, C. Antinuclear antibodies, D. IgM antibodies to B. Burgdorferi, anti-neutrophil cytoplasmic antibodies, or F. Vertebral compression fracture. The answer is A. This patient has ankylosing spondylitis, a chronic inflammatory disease of the spine and sacroiliac joints that often lead to the stiffening or consolidation of the bones that make up the joints. Common findings are low back pain, stiffness over 3 months, pain and stiffness in the thoracic region, limited movement in the lumbar area, and limited chest expansion. Around 90% of the patients are positive for HLA-B27. And common complications include uveitis and aortic regurgitation. Okay, next question. A 17-year-old girl complains of painful, swollen left elbow and fever. In the previous days, her right knee was also swollen and slightly painful. Physical examination is notable for several oral ulcers and an edematous and tender left elbow. Lab tests reveal anemia, a weakly positive ANA, and the results of VDRL testing are positive. The patient is shocked when you inform her that her tests are positive for syphilis, stating that she has no sexual history. Which of the following is the most specific antibody for this patient's condition? A. Anticentromere, B. Antimicrosomal, C. Anti-IgG, D. Anti-Jo1, or E. Anti-Smith. The answer is E. Anti-Smith. The patient has findings suggestive of lupus, arthritis, oral ulcers, fever, anemia, and positive antinuclear antibodies. As is the case with many SLE patients, this one probably also has antiphospholipids antibodies. These autoantibodies react to the cardiolipin antigen used in syphilis serology, thus giving a false positive result for syphilis. ANA antibodies are sensitive for SLE, but anti-Smith and anti-double-stranded DNA are the most specific markers for SLE. A 35-year-old woman from Arizona comes to the physician with an X-ray film of her chest taken during a routine health insurance examination. The X-ray film shows bilateral hilar adenopathy. The patient is completely asymptomatic, and sarcoidosis is suspected. She was told that her serum levels of angiotensin-converting enzyme, ACE, were elevated. The sensitivity and specificity of using ACE levels to test for the disease in question are 80% and 50%, respectively. Assuming that sarcoidosis is highly prevalent among residents in the southwestern United States, how would the patient's place of residence affect the positive predictive value and the negative predictive value of the test? A. In areas of higher prevalence, both the PPV and the NPV are lower. B. In areas of higher prevalence, the PPV is higher and the NPV is lower. C. In areas of higher prevalence, both the PPV and the NPV are higher. D. In areas of higher prevalence, the PPV is lower and the NPV remains the same. Or E. Regardless of the prevalence, both the PPV and the NPV are unchanged. For any given test, as the prevalence of the disease increases, the PPV increases and the NPV decreases. Therefore, the answer is B. Alright, next question. A 7-year-old girl has numerous vesicles on her face, particularly around her mouth after falling and scraping her face on the ground. Over a few days, these vesicles turn into pustules and crust over, becoming flaky and light yellow in color. Which of the following statements about the organism most likely responsible for the girl's infection is correct? A. The bacterium is sensitive to bacitracin. B. The bacterium is a facultative intracellular organism. C. The bacterium is alpha hemolytic. D. Sabarod's agar is required to culture this bacterium. Or E. Endotoxin is present in the outer membrane of this organism. The answer is A. This girl has impetigo, most likely caused by strep pyogenes, a gram-positive group A beta hemolytic organism that is bacitracin sensitive. Bacitracin is used to differentiate S. pyogenes from S. agalacti, which is bacitracin resistance, whereas opticin is used to differentiate S. pneumoniae, which is sensitive to opticin, from S. viridans, which is resistant. Impetigo is characterized by an eruption of vesicles on the face. These vesicles later turn into pustules with a characteristic honey-colored crust, which is described as yellow in color here. A distinctly bullous form of impetigo is caused by Staph aureus infection. A 12-year-old pitcher throws a fastball in the Little League World Series baseball game and immediately feels a sudden tearing pain in his right shoulder. He is rushed to the ER, where an orthopedic surgeon discovers that he has lost the ability to rotate his arm laterally. Shoulder function is otherwise intact. Which muscle is most likely injured? A. The supraspinatus. B. The teres minor. C. The subscapularis. D. The infraspinatus. Or E. The teres major. The answer is D. 4 key muscles make up the rotator cuff: the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. These can be remembered using the mnemonic SITS, where the lowercase t is for teres minor. Although shoulder injury could result from damage to any of these muscles, only damage to the infraspinatus muscle prevents rotating the arm laterally without causing any other symptoms. Alright, moving on. A 57-year-old automotive factory worker with no significant past medical history reports to the clinic complaining of weakness and pain in his right shoulder with any movement. He says that for the past 2 weeks, he's had trouble lifting his arm above his head. He reports using his left arm to lift his right arm just slightly, and then he can lift his right arm the rest of the way without help. Which of the following muscles is most likely injured in this patient? A. The supraspinatus. B. The infraspinatus. C. The teres minor. D. The subscapularis. Or E. The deltoid. The answer is A. The supraspinatus muscle is the most frequently injured rotator cuff muscle. Patients often report pain anteriorly and superiorly in the glenohumeral joint during abduction. The primary motion of the supraspinatus is the first 15 degrees of abduction of the arm, at which point the deltoid muscle continues the motion of abduction. Therefore, as long as a patient can assist the injured rotator cuff at the beginning of abduction, he or she will be able to continue the motion totally unassisted thereafter. The muscle and its tendon can be torn traumatically, but it is most often injured in a more insidious manner because of repetitive movement. which is the likely cause in this case. Alright, let's move on. A 21-year-old male with no significant medical history presents to the emergency department after an injury to his shoulder sustained while playing football. His shoulder is swollen and erythematous. Active range of motion is limited, and he is unable to abduct his arm. Diagnosis is fracture at the surgical neck of his humerus. Which nerve roots are responsible for the muscle dysfunction? A. C5-6, B. C3-5, C. C6-7, D. C7-8, or E. C8-T1? The answer is A. In a fracture of the surgical neck of the humerus, the axillary nerve may be damaged and the posterior circumflex humeral artery may be lacerated. The patient's inability to abduct his arm suggests compromised innervation to his deltoid. The deltoid is innervated by the axillary nerves, whose fibers originate at levels C5 and 6. The axillary nerve is a branch of the posterior cord of the brachial plexus. Because the axillary nerve courses around the surgical neck of the humerus, it's often injured in fractures at this region. Over time, there would probably be noticeable atrophy of the shoulder region. Okay, last question. An 85-year-old man is brought to the emergency department by his daughter after he falls at home and hurts his left hip. Further examination shows that he sustained a hip dislocation. In the following weeks, he has difficulty standing from a sitting position and requires assistance going up and down stairs. When he attempts to play hopscotch with his grandchildren, he also discovers that he can no longer jump or hop on his feet. What is the name of the nerve that innervates the injured muscle? A. S1, S2 nerves of the lumbosacral plexus. B. L5-S1 nerves of the lumbosacral plexus. C. The femoral nerve. D. The inferior gluteal nerve. Or E. The superior gluteal nerve. The answer is D. The inferior gluteal nerve. This innervates the gluteus maximus, which commonly is injured with a posterior hip dislocation. This is the most likely injury to this patient, given the fact that he has difficulty standing from a sitting position. Damage to this nerve also prevents a person from ascending stairs or being able to jump.